How are you making out, Jeannie?
Well, my patient's receiving warm, sterile compresses several times a day to her wound.
And why is that?
Well, to promote circulation, encourage wound healing, and to decrease pain and discomfort at the wound site.
Does she have pain from her wound?
Well, she gets intravenous pain medication prior to her wound care. Her nurse gave it to her about 20 minutes ago.
Very good. I'm glad you used foresight and intervened to control her pain before we started the dressing change. Now, how do we begin?
Well, I checked the order for solution type and frequency and length of time that the compress is to be applied. I've got what we need here, and on the way to the room, we can stop and pick up the foil-wrapped compress out of the warming device.
Great. Follow me.
Hello, Mrs. Estevez.
Hello.
Miss Estevez, this is Miss Swenson, my instructor.
Hello.
She'd like to observe while I do wound care. Is that okay?
Of course it is. Is it really a wound? I thought it was more of a large scratch. Wounded sounds like I'm a wounded animal.
Well, I'm sorry about that, Mrs. Estevez. We use the word wound for any opening on the skin, but I understand. I'll try not to use that word around you, okay?
Thank you.
All right, I'm going to look at your ID band. Could you tell me your full name, please?
Rosemary Estevez.
Okay.
What are you looking for before you start this procedure, Jeannie?
Well, I'm going to assess for circulatory compromise in the area where the compress is going to be applied.
Right. This includes looking at skin color, checking pulses distal to the site, and noting the presence of edema and sensation.
Okay. Do you mind if I pull the blankets back down? Okay. Okay, it's a good pulse. I'm going to put the waterproof pad underneath your leg. Thank you. Okay, I've already washed my hands, so I'm just going to put on clean gloves now. I'm going to remove the old dressing. You might feel the tape pulling just a little. Are you in any pain?
No, that pain medication really does the trick.
Good. Okay, now I'm going to assess the wound. Oh, I'm sorry, I mean scratch. For any inflammation, drainage, skin color, ecchymosis, and odor.
Odor? Lovely.
It actually looks pretty good. The redness around the open area seems to have decreased. So I'm just going to open up my compress now. Thank you. I think I'm ready for the sterile gloves. Now, I'll gently and carefully mold the compress to the open area. I'll apply a layer of gauze on top. And I'll cover it with the bath towel. Would you mind lifting your leg again? Now I'll start the clock. Mrs. Estevez's treatment is for 20 minutes.
Also monitor the condition of the patient's skin and their response to treatment, Jeannie.
Okay. I remember that heat is not to be applied for more than 30 minutes at a time.
Right. And what will you be looking for when you remove the compress?
I will be checking the skin condition, the patient's reaction to the heat application. I'll note any changes in the wound or scratch. And then I'll put on a sterile dressing.
Very good.
Okay, I'm going to cover you back up. Do you need anything else?
No, I think I'm fine. I know I can be a little difficult. Thank you for being so accommodating.
You're welcome. No problem.
Thank you, Ms. Estevez.